Good afternoon and welcome to the Mid-America Regional Council's Local Operations Briefing for Friday, May 29th. Today we will take a look at the current situation and what has happened over the past week. I am Jeff Taylor and I will be presenting today on behalf of the Mid-America Regional Council. Should you have any questions during the briefing, please add them to the comments section of the video and we will do our best to respond to them in future briefings. The Kansas City Regional COVID-19 Resource Hub is publicly available at preparemetrokc.org. The Resource Hub is updated daily with the most current information on COVID-19 cases, tests, and deaths as reported by the 9 counties in our region in Kansas City, Missouri. The Resource Hub now includes a link to summary of Phase 1 and the beginnings of Phase 2 regional reopening plans to compare regulations by each jurisdiction. The document will be updated regularly as new information becomes available and for future reopening phases. Today, there are 5,081 confirmed cases of COVID-19 in the region and we've had 194 deaths. This represents an increase of 437 cases and 9 deaths over the last week. This is a look at regional testing and confirmed case data. The table to the left shows weekly comparisons since April 19th and the right shows cases per 100,000 as of May 28th. It should be noted that Leavenworth County's increase in numbers are due to the inclusion of Lansing's Correctional Facility into the county's population. Here is a look over the last 2 weeks. The chart on the left shows confirmed cases over the last 2 weeks and the chart on the right shows case counts and trends in the region. At this time, we are seeing reported cases and test results leveling off at 11%. This slide shows the Healthcare Coalition's northern and southern districts surrounding the Kansas City Metro. This slide is important as it shows how areas outside the MARC area are doing in overall contrast to our area. The Multi-Agency Coordination Group met on Tuesday, May 26. The MACG has asked the leaders of the public health departments to develop details for the gating criteria tied to the reopening plans. This is an effort to help with regional coordination and public understanding of how the decisions are evaluated for advancing through reopening phases. Public health representatives reported on Tuesdays that they have consensus and are set of a mind of matrix that are working to ensure that they can give the necessary data across the counties before finalizing and realizing their recommendations. Meanwhile, there is a recognized need for public increase in the region's overall capacity for performing testing and contact tracing. This needs to be done not just now, but for things that we might face in the future. Both states are working on plans, and the MARC is working with public, private, and non-for-profit partners in proposals of regional strategies, supplements, and support of local efforts, testing, contact tracing, and community support for vulnerable populations. The MAC will again meet on Tuesday, June 9th. Additional information about these public meetings is available at the public meeting calendar at www.marc.org. Here are our agreed upon strategic objectives. These objectives define our commitment to the COVID-19 response. These objectives are to save lives, protect the population, ensure cooperation and coordination, as well as plan for long-term recovery after the event. This slide shows our lifelines. The status of all 7 lifelines throughout the region is green, but are hampered by shortages of personal protective equipment where consumption rates exceed the supply rate through our region. Otherwise, all lifelines are functioning as required with no mission-critical shortage of personnel, equipment, or supplies forecasted within the next 48 hours. Now we will quickly go through the activities of our emergency support functions. ESF6, Mass Care, Emergency Assistance, Temporary Housing, and Human Services. A number of facilities are established around the region to provide testing and resources to homeless and vulnerable populations. The Greater Kansas City Coalition to End Homelessness maintains a COVID-19 resource list on its website, which is linked on the screen. In Jackson County, a COVID-19 isolation center has been open since May 14th and is offering its services to other area counties that might be in need of isolation and quarantine services. Any agency with individuals needing to use the shelter must call for pre-screening prior to being approved for utilization of the shelter. Please contact your emergency medical director or your ESF6 homeless or ESH lead for additional information. The MARC CDRN group has donations drop-off locations established for Kansas child care providers at Harvest Christian Center International Leavenworth campus. The point of contact is Pastor Sharon Walker. Preparations are being made to find a new centralized warehousing location for mid-June to allow the Sermon Community Center to reopen its public the first week of July. This slide gives a brief description of ESF 6 activities happening now. ESF 7 Logistics. ESF 7 has been working with MARC staff on PPE purchasing efforts through the Kansas City Regional Purchasing Cooperative. As the region responds to the COVID-19 pandemic intensifies, MARC and the Kansas City Regional Purchasing Cooperative works from input with local jurisdictions, including healthcare facilities as well as fire and law enforcement, to establish regional purchasing cooperative contracts for personal protective equipment on behalf of the MARC members. Also, through ESF 7, local agencies are working with the state of Missouri to safely decontaminate thousands of N95 masks utilizing new decontamination systems. This is greatly reducing the stress of having to find and provide new critical N95 masks that are needed for healthcare providers to protect themselves while caring for COVID-positive patients. Where this helps, it does not reduce the need for new equipment. ESF 8 Public Health and Medical Services. The Missouri Department of Public Health will start with their Phase 2 of their Show Me Strong Response Reopening Plan starting on June 5th. Some of the key items will be increasing the number of people in mass gatherings and the number of people allowed in restaurants. For the state of Kansas, on Tuesday, May 26, Governor Kelly amended the state stay-at-home order to just a set of guidelines. This allows each individual county within the state of Kansas to decide their reopening steps and what those should look like. The recommended guide is the same as the ad asterisk that had been used prior to the May 26 date by the state of Kansas. In the local area, the city of Kansas City announced yesterday that they were moved to Phase 2 of their stance and loosening Kansas City's stance to better align with Clay, Platte, and Jackson counties. This phase goes into effect Sunday, May 31st and will remain in place until July 5th. In Phase 2, this will allow restaurants to move tables from 10 feet to 6 feet and allows essential businesses to open at 100% capacity. As other areas change their phases, we will update this in our next local operations briefing. ESF 14 Long-Term Community Recovery. This group continues to explore what their recovery strategies will look like and find the best way to ensure that they're meeting the needs of the community. ESF 15 Public Information. Public information continues to focus on reopening plans and the messages that go with those plans. For the latest updates, please visit www.preparemetrokc.org. Key notes to take away are: how quickly and effectively our community can reopen is directly related to the spread of COVID-19, which depends greatly on the community response. Recovery plans are not a return to normal. Returning to normal will take a long time. Social distancing requirements, protective masks, and cleaning protocols are critical in slowing the disease. These practices will need to continue for the foreseeable future. Wearing masks in public is highly encouraged to help prevent the spread of the disease. The hashtag SafeReturnKC Guide is a regional resource to help guide your business on how to bring back your workforce safely. Visit www.preparemetrokc.org if you need support with food, childcare, job loss, home learning, and more. These resources are updated daily. For those that are looking to assist in the community, the Medical Reserve Corps is currently continuing to recruit volunteers. For more information, visit www.mrckc.org. As we continue to move forward through the pandemic, it is important that we begin to start to collate information, filter through that information, and start putting together after-action reports. The information that it is needed to be collected is dates of declarations of emergency and public protection actions, what best practices were identified, what actions were needed to sustain operations and public safety, what could have been done differently to improve the overall response efficiency, and other key elements that were caused by the pandemic that affected jurisdictions. As a reminder, if you're ever looking for more information, you can find it on these websites. As the greater Kansas City business community adjusts to day-to-day operations in the response to the COVID-19, we must balance the need for maintaining a regional economy with the protection of our community's health. The Kansas City Chamber, the Kansas City Area Development Council, the Civil Council of Greater Kansas City, and the Mid-America Regional Council are working together for #SafeReturnKC. You will find more information at preparemetrokc.org. In closing, we remind you that we are posting these periodic briefings to Prepare Metro KC's YouTube channel. Please subscribe to the channel and sign up for alerts to receive notifications of future briefings. We will monitor comments posted to the briefing videos for questions that we can answer in future briefings. Thank you for your attention, and this concludes our briefing.